in a shipyard where they construct and repair and repurpose vessels of all sizes and shapes. A remarkable array of specialties and fields of expertise work together toward a common goal. Crane operators, welders, and engineers combine with chemists, accountants, security, IT, and military personnel to fashion ships capable of traversing every body of water known to our planet. It is an extraordinary undertaking, particularly because, even as it produces tangible, visible results, a shipyard is no one thing. It requires no one skill set, but a myriad number of them. When considering an undertaking like graphic medicine, the principle remains the same. This field may draw most directly from comic studies, its welders and early engineers, perhaps. Moreover, we may have our first generation who are native to graphic medicine, figuratively born on these docks and always having had this view of the horizon. But all this would be fruitless and altogether incomplete enterprise without the active influence of three affiliated fields, at least, that I would like to highlight in this lecture.
In her chapter, The Crayon Revolution, for the Graphic Medicine Manifesto, M.K. Serwick makes a notable comment about her advocacy of self-portraiture by medical students. Having them use crayons, the great equalizer, Serwick allows them to access an innate visual language that they all already possess. It has been there since their childhood, since the time where supposed talent in terms of one drawing did not matter, nor did how realistic a composition one could produce. I would actually say that good drawing is being able to create a drawing that expresses an emotion, one that people can read, understand what you are trying to say, and are moved by it. That ability still resides in nearly all of us, and it can be tapped through crayons and through comics, both an invisible art when described by theorists like Scott McCloud, but also a medium of simplicity and efficient of form when employed this way by Serwick. The assignment for these medical students is often a revealing one, as they depict themselves voluntarily as being under immense stress or unmanageable expectations. This is where Serwick states, to be clear, this is not art therapy. It is image making that may indeed be therapeutic, but that is not the goal. This disentangling of graphic medicine's therapeutic value, but its distinction from art therapy, also displays the tie between the two fields, namely the empirical support that art therapy has merited and the standard to which graphic medicine must hold itself. Devlin McCreight reminds us of this in his article for Counseling Today. Although interest regarding the intersection of health services delivery and comics is at an all-time high, empirical research regarding the efficacy of comic creation as a direct intervention is largely absent. This might dissuade practitioners from introducing comic making into their therapeutic work, but it is important to remember that every testable intervention begins with a theoretical question, moves to the gathering of qualitative anecdotal evidence, and then transitions to quantitative outcome measurements. Presumably, this is where you, the student or advocate of graphic medicine, come in, adding to this multi-layered field with newer, sharper data as it is further deployed.
In addition to art therapy in application, graphic medicine also operates alongside the field of disability studies in context. In her legendary book, Illness as Metaphor, Susan Sontag observes, "Illness is the night side of life, a more onerous citizenship. Everyone who is born holds dual citizenship in the kingdom of the well and in the kingdom of the sick. Although we prefer to use only the good passport, sooner or later, each of us is obliged, at least for a spell, to use the other passport, to identify ourselves as citizens of that other place." Some, of course, spend a lifetime in the night side of life, either as the result of an accident, a trauma, an illness, or their birth. In the case of Victor Stone, DC Comics Cyborg, the character is not only disabled due to a horrible accident, but is also located, according to Jonathan W. Gray, as a triple minority. Stone is black, post-human, and disabled, effecting a narrative stasis for the character, a maintained tragic and pathologized view of disability that, in the parlance of Jordan Peele's film Get Out, makes the kingdom of the sick also Cyborg's sunken place.
Even when narratively activated, Stone rarely enjoys the agency that his fellow superheroes, nearly all able-bodied, Caucasian-looking, and whole, do. Robert Jones's essay, Humanity Not Included, reads Cyborg as Jim to the childlike Shazam's Huck, or as the cosmic chauffeur to the rest of the Justice League. Cyborg serves in the racist mold of the buck. So of course he's an athlete. Of course he plays football. White supremacy must always find some productive use in black bodies, must always be able to capitalize off of our labor. Sometimes, when white writers are attempting to write black characters, they rely on stereotypes because they can't imagine black people as actual human beings. Notably, the superhero genre itself is relatively dismissive of the human being overall. Even before engaging in issues of race or disability, Jose Alaniz, in his book Death, Disability, and the Superhero, characterizes the genre as having an utter intolerance to death, not only fighting against mortality, but also from recovering from it and even transcending it. When very rarely a superhero actually succumbed to death, it had to be done in a heroic manner. Their deaths not only had to mean something, they had to accomplish something. Alaniz points to only a handful of superhero deaths that are what he calls existential deaths, death which means nothing and accomplishes nothing. Even with the few existential deaths Alaniz recounts in his chapter, most are women, along with young boys, a dwarf, and a black man. This is to suggest that death, particularly a permanent and meaningless one, is troublingly framed as non-normative in the superhero genre, as something not directly applicable to a white, male, able-bodied model. This is what makes Jim Starlin's The Death of Captain Marvel so notable, and such a fascinating case for graphic medicine, both in terms of the depiction of cancer and in terms of the superhero genre.
And this, along with art therapy and disability studies, returns us to the third associated discipline we must consider, namely narrative medicine. To quote McCrae, there is a unique space created by comics to be utilized, as we have seen by art therapy and disability studies, by mental health clients and patients especially, in safely capturing their experiences. The idea of containment is extremely important when dealing with sensitive parts of a client's experience. Each panel in the comic sequence functions as a figurative container for potentially overwhelming psychic material, allowing clients to approach the issue with a feeling of control or mastery that might elude them otherwise. The comic format also allows clients to represent themselves, others, and even their disorders pictorially through the creation of avatars. McCrae highlights the work being done by DARPA to aid combat veterans with PTSD. Comics allow them to detail their experiences and their sensations without necessarily inhabiting them. They can process and find meaning in it while, at the same time, safely externalizing it. When discussing narrative medicine's overall capacity to uncover trends, themes, and connections in patient stories, Dr. Shannon Wooden points to her experience with one patient's resistance towards hospice care. Employing the tools of narrative medicine, of narrative knowledge, she could determine that all of his stories were about power. As with the veterans, sensitivity to a narrative channel allows for greater insight on the part of the healthcare practitioner. Presumably, Dr. Wooden's team could communicate the benefits and needs of hospice care without sacrificing the patient's concern for personal agency and for control.
Quoting Columbia University's Rita Charon, Serwick identifies the shared mission of graphic medicine and narrative medicine with medical professionals to enable them to recognize more fully what their patients endure and to examine explicitly their own journeys through medicine. Charon, herself a physician and executive director of the program in narrative medicine at Columbia, advises medical students to keep a parallel chart of patient stories and metaphors alongside their medical chart. And her book, Narrative Medicine, details how such an instrument can be maintained. In terms of graphic medicine, Serwick offers that either a parallel chart or the creation of one's own comics allows practitioners and students a greater ability to reflect on their many potential roles.
As outside observer, as patient, as medical practitioner, as family present to the encounter. Graphic medicine does not spring out of art therapy, disability studies, or narrative medicine whole cloth. These disciplines can be more readily seen as crops grown in the same fertile field, as all different sort of machinist and nautical tools in the same shipyard. A linked ecosystem or one immense operation. Choose the metaphor most suitable for you, of course, but in doing so, consider your position in it. What fields do you connect with graphic medicine? Where is your specific acreage? What's your bearing? Early in her book, Charon discusses accepting the mythic register of her family name, Charon being a grave name for a doctor, recalling Charon the boatman in Greek mythology who ferries the dead across the river Styx to Hades. In time, she came to see her name in a new light, finding that Charon's task is ours, to know as best we can how to navigate that journey, how to recognize that shore. With Charon's mission in mind, then, I'm inclined to disagree with the characterization of graphic medicine as parts of the doctor's toolkit, or even as Cyborg aptly puts it, as a window. Graphic medicine, to me, is the boat. Whether it's Charon's vessel, a vehicle for enhanced mobility, or a beautiful construction, graphic medicine is the craft that can accommodate so many of us, passports in hand, on its deck, and so many distinct versions of us as well. Cyborg is right in that, as a medium, comics are simple and efficient, thereby leaving room for all manner of passengers, including one's own multiplicity of selves and roles.
Allons-y.